Alamada's local news station.
Hello, I'm Ella Sogomonian. You're watching Cron On. Now that the Bay Area is under a shelter-in-place order, some may be wondering, is it making a difference in slowing the spread of COVID-19? For some answers, I'm joined by Alameda County Health Officer Dr. Erica Pon to help out with some of those questions. Hello, Doctor.
Hello, good afternoon.
So as of 4:40 on Wednesday, we're seeing that Alameda County has had 31 positive cases of the coronavirus. Can you take us down the timeline to when the first case was confirmed, and what are we seeing with the rate of this infection?
Sure. On March 1st is actually when we confirmed our first case in Alameda County, and then we only had about 3 as of early last week, I believe, and then just over the last few days, we've certainly seen a dramatic increase in cases, and more importantly in the Bay Area, just for basically the weekend, we were seeing an exponential increase in the Bay Area.
So we keep hearing this leveling of what we're looking to do in order to, avoid more people getting infected all at the same time. Are we seeing the peak? Is that what we're seeing with that trend?
So it's what we call the acceleration phase to that point, and you're right, we tend to see with an epidemic or a pandemic a peak and then eventually a fall. People do need to keep in mind, though, that our knowledge of the incubation period of this virus is anywhere from 2 days up to 14 days at its longest. So most infections seem to be within a week after exposure, but we wouldn't see the impact of this social distancing measure to flatten the curve for at least another week or so. So we do anticipate we're going to continue to see an increase in cases, but we do hope the rate of increase does start to slow down based on all the social distancing movements.
And are the people who have been infected in your county falling in line with who is most vulnerable?
There are so many cases at this point. We have not had a recent summary of that, but my general understanding is yes.
Can the young and the healthy experience some strong symptoms or even die?
So again, the most vulnerable for hospitalization and severe illness are the elderly and those with underlying medical conditions, but certainly, like with any disease, younger people or other people can also get it and get more of a severe infection. Similar to influenza, most people who get the flu can be hit hard and home for a few days but recover quickly, and then there are some rare situations where otherwise healthy people have really serious disease.
So you say that we're seeing the acceleration phase. When can we expect a slowdown in infection rates, or is it too soon to tell?
I definitely think it's too soon for us to tell.
And are there challenges that are unique to Alameda County?
I think one of the big challenges that's unique to us is we, as a public health department, don't have our own healthcare system. So we work closely with our healthcare partners, but it's just a different situation when we don't have our own clinics and under our own umbrella to help coordinate some of the safety net healthcare and things like public health testing for people that don't have other insurance, like that.
And so President Trump promised millions more test kits across the country by last week. Has Alameda County seen them yet, or are you guys getting any other help from both the state or the federal government?
So there are more, as we understand it, commercial labs coming up and running over time, and we know that last week one major commercial lab started, and they got immediately over their capacity, but we understand they're ramping up more this week, and also that Roche is getting up and running. So I think certainly with commercial labs increasing their testing, and we've heard more of their systems, whether it's HCs or the larger health systems are slowly getting more as well. And within our public health lab, the other new regulation that happened was we were allowed to use just one sort of test kit instead of 2, or run one specimen instead of 2 per person. So that doubled our capacity, but it's still somewhat limited in our public health.
Are we going to expect to see more drive-through testing areas around Alameda County, or where can people go? Because I've seen some private clinics that have been posting signs on their doors specifically saying we don't test for COVID-19 here.
That's a great question, and I do think there are going to be more clinics that are doing that. But we want to emphasize to everyone in general that even when more and more kids come, first of all, we're not recommending that anyone without symptoms needs to get tested, and people with mild illness actually, now we're all staying at home, and you need to just stay home and only seek testing if you either have those underlying conditions, or you're elderly, concerned about becoming more ill, or you have more serious symptoms like difficulty breathing. as far as where else go, yes, more health systems are funded and people who are high priority or at risk from others. Some of the other priorities would be healthcare workers who are on the front line taking care of ill patients, close contacts of other confirmed cases, and other people in sensitive occupations or situations. So other high-risk settings, and especially in residential settings for the elderly, places like that.
What else are you guys in need of right now for your health department to be up to speed with the demand here? And have you already put in any requests with the state or federal government for that?
We've been putting lots of requests for personal protective equipment for our healthcare systems, and as we all know, there's a lot of requests for hand sanitizer. I think we just got some information today about assistance with homeless people who don't have housing otherwise, and especially if we have a person. I see that your previous features were on how we're dealing with homeless, so we certainly need places to isolate people who have symptoms or test positive for COVID-19. So that's the area that we're working on to get some information about research today for that.
And I know there's concern about avoiding touching your face. So where does the county health department stand on whether the general public should use masks? Because I've seen the Chinese government pushing people there to use them, and they've credited that for the slow of spread eventually that they have ended up seeing. But why have we been telling people the opposite?
Well, there's a few reasons. Masks in general are most helpful as far as the public only if someone has respiratory symptoms, try to contain them and prevent others around them from getting infected. And we really already, as just mentioned, what we're really trying to get is personal equipment for the healthcare workers who are on the front lines taking care of ill patients. And we do have a shortage, so we really need to prioritize people who are taking close care of people who have. So it's not recommended and not necessarily helpful. There's not demonstrated evidence that I'm aware of that it would be helpful for the public to wearing masks.
So a mask shortage is one of the main reasons you're saying?
And I don't know that I've not seen demonstrated data showing that having the general wear mask.
And can the virus infect through the eyes anyway?
So theoretically, as people have been learning, the virus can live on surfaces. So, and with other viruses as well, if you touch something that's contaminated with a virus and then touch any of your mucous membranes, so it could be your eye, nose, or your mouth, then you could. We don't think that's something that is driving the transmission. We think most of it is direct droplet, face-to-face, close contact transmission, but it is something in order to be careful why we're saying your face and frequently disinfect high-touch surfaces and make sure to wash your hands before you're eating or your mouth and things like that.
Going back to the shelter in place, we are being told to keep away from one another or maintain a 6 feet distance. But if this virus is airborne, can it travel far anyway?
So again, we're still learning about this virus every day, but everything we know about other coronaviruses is that they're primarily droplet transmission, which means, again, that they would fall down to the ground and not infect people more than 3 to 6 feet away. So that is where we come up with this 3 to 6 feet distance. In the hospital as well, for example, we use certain precautions for droplet precautions if you're going to be within 3 feet of the patient.
And Alameda County is one of 6 others in the Bay Area who is sheltering in place. People who are feeling the economic impact with businesses grinding to a halt are wondering, why are we having the general population stay indoors and not just those who are most at risk?
So we really wanted to flatten that curve and really interrupt the transmission of the virus. The other real important reason to flatten the curve is not to overwhelm our healthcare. We are very concerned. Others are seeing what's happening in other countries in Europe and elsewhere, that if we have that continued acceleration and increase in the number of critically ill people, that our hospital system might not be able to accommodate that. So we need to all participate together as a community to slow the spread of transmission in general.
And to help out that, we are seeing stores welcome seniors to shop first. Is that a good idea, or is delivery the best option for them?
I think it's a great idea. It's similar to a concept we have in hospitals when we're trying to avoid cross-contamination when there's multi-drug resistant patients. So we usually try to have the opposite happen where you have people rounding on patients first that don't have those infections. So it's a great idea to have people go early on when there's not other people that it might have been or that could have had the disease or things.
And so we're also seeing disinfectant wipes sell out. What can be used as a substitute to clean hard surfaces?
So certainly, the other easy thing to do is bleach and diluting bleach, and there's a lot of great information online about how to use which dilution to use to help be a disinfectant.
Which businesses are considered essential that can remain open during this shelter in place? Because I am seeing reports of people lining up at gun stores that were still making sales as of yesterday. Do they qualify as essential?
We certainly did not outline gun stores as something in the health officer orders that the 6 counties did. We do have a long list in the actual order and in our frequently asked questions on our website, acphd.org. And we really focused on essential businesses, including any kind of food or restaurants for takeout and delivery, health and medical, so pharmacies, and there's a lot of other businesses that are really important to make sure the health and safety of our community can still be maintained.
And what about the homeless? Can they remain outside? And if not, how are they being contacted and then helped?
So our homeless outreach teams in Alameda County have been doing a lot of outreach and working with other city partners and community-based organizations to do outreach, and both in the shelters and the encampments, providing more information. And then we are working on plans again if people have symptoms to get them tested and find a place outside of those settings. So we've been doing a lot of work on that here in Alameda County.
So if a homeless person tests positive, is that when they will be provided some sort of shelter?
Yes, and per the other directive from the governor recently, we're also working on what other resources we have to help with homeless persons to get them housing.
And so once a shelter in place is lifted, what's the likelihood of this disease coming back?
So that is a great question that is in all of our minds, and I think we need to gradually, and we will gradually, based on all the people that are already infected and improve, we'll get some immunity in the population, but people who might not have been infected initially while we're in a shelter in place could then get exposed again later. But again, we're trying to slow down the spread of the virus and really protect, again, our most vulnerable. But that's something we're thinking about and looking at carefully around, how long will this be, and how will we modify things over the next several weeks.
I've heard from people who lived in other countries decades ago who say that at the time when vaccines weren't readily available, that if they heard, for example, a kid got sick with measles, that all the parents would then bring their children to that house so that they could get it at this earlier stage in life to better fight that off and then not have to worry about it in their older age. Why is that something that is not practical at this point?
I think we're still learning so much about this virus. We want to do everything we can to protect those we already know are most vulnerable, and it allows us time to learn more from the other countries that were hit first and learn more about the virus. And as you mentioned earlier, we think in general most people will get mild illness, but as we learn more about what are the risk factors, it's helpful to minimize the impact and slow the spread so we can better understand and better protect the people that are going to have the most serious illness.
And a Stanford University professor named Michael Levitt reassured people in China, predicting that the peak would end, and they've actually seen a dramatic slowdown now in their new cases. Where are we at in comparison, and can we look forward to that same reassurance?
So again, we're just in the beginning, I think. We just had here in Alameda County one case on March 1st, and here we are on March 18th, and have our 31 cases. So we're just in the beginning, and as you saw in China, it did take several months for things to peak and then come down. So I think we, again, we don't have a crystal ball, but this is exactly why we really appreciate everyone coming together as a community to implement the social distancing that we've asked for to slow the spread. And see, we'll know more in the next couple of weeks about how quickly things are still moving and make some of the determinations. But we are still learning, and we don't know yet.
Thank you so much to Alameda County Health Officer Dr. Erica Pond for joining us and talking about the latest in sheltering in place to try and prevent the spread of the coronavirus.
Okay, thank you.
You're watching Chron On, the Bay Area streaming news 24/7.